Hey guys, Dr. Childs here. Today we're going to be talking about how to find good thyroid doctors. And I'm going to be talking about things that you can do, specific things that you can look for to make sure that you are finding a thyroid doctor that is going to be able to prescribe thyroid medications beyond levothyroxine, one that's going to be able to order lab tests beyond just the TSH, and one that's going to help you actually feel better. So these are the techniques and the tips and the tricks that I would recommend if I was starting from scratch and trying to find somebody that would actually help me. So number one, the first thing that I would do is I would call local compounding pharmacies and see if I can get a list of doctors who use or prescribe compounded thyroid medications, including things like sustained release T3 and compounded T4 and T3 thyroid medication. If you don't know, compounding pharmacies, these are pharmacies which can actually make prescription medications in very specific and unique ways. So they can take out fillers, they can take out binders, they can add combinations of medications that don't otherwise exist from the regular big box pharmacies and so on. And most regular conventional doctors, including family practice doctors and endocrinologists, they aren't even aware that compounding pharmacies exist because all they do are send their patients to these big box pharmacies like CVS and Walgreens and Costco and so on. But these compounded pharmacies, there's a good chance if a doctor is prescribing a compounded thyroid medication or a compounded medication in general, that they're at least open to and aware of alternative treatments that benefit thyroid patients. So you can call them. Now, it may be more difficult to get a list of doctors from them, that maybe they may keep this sort of thing confidential, but there may be instances in which they say, oh, we have cards that are left on the counter and so on. So if you physically go in there, you might find a list of doctors who have left, their name or business card or something like that around there. And you can, if you do some investigative work, you should be able to find at least a handful of local doctors. It's also probably the case that if there is a doctor who is using a local compounding pharmacy, they probably live locally. They're not probably in another state. Even though that may exist, I would sometimes use compounding pharmacies that were in other states. So that can happen, but it would still be worth a try. Now, the easiest thing for you to do is to just Google or use Bing or whatever it is that you use. Just type in the local compounding pharmacy and you should find one that's probably near you. If you live in a big city, then you should have several near you. There should be many near you because there's probably, 8 to 10 around me in the Phoenix area. So there's probably a ton by you if you live in a big city. So that's the first thing that I would do. The next thing that I would do, if you think you have found a doctor that has potential, I would call that doctor's office and try and speak to either that person's nurse, medical assistant, or the front office and ask them a couple questions. You want to ask them something like this: is this doctor willing to order more than just the TSH? So if they say, and if they have no idea what you're talking about, then that's probably a sign you don't want to continue the conversation. But ask if they're willing to order more than just the TSH. Ask if they are also willing to use something like Tirosint or Armour Thyroid in place of levothyroxine. If a doctor is more willing to use even something like Tirosint, that's still way better than doctors who don't even know what Tirosint is. So if you're hearing about Tirosint for the first time, go watch videos that I have done on Tirosint because it's a great medication and it can be used in place of levothyroxine. And if a doctor is aware of Tirosint as an alternative to levothyroxine, that's a really good thing. And also if they're willing to prescribe natural desiccated thyroid like Armour Thyroid. So specifically say Armour Thyroid because if a doctor is not maybe as in tune with thyroid problems, they may not respond well to like Nature's Thyroid or NP Thyroid or WP Thyroid. They may not even know these things exist. So start with something like Armour Thyroid, which has been around for a very, very, very long time. The last thing I would do is I would ask them, or another question I guess to consider, you don't have to do this, but I would consider asking them if they will allow or support or endorse the use of natural supplements in addition to thyroid medications. There's a good chance if the doctor says, flat out, no, I don't want you to take any supplements in addition to whatever it is that I prescribe you, that's probably not a good sign because supplements can be very helpful. And most doctors who understand comprehensive thyroid management and you get the results that you're looking for, they know that supplements can be beneficial to thyroid patients. The next thing that I would do is I would look at the online ratings of doctors to see what kind of experience that whatever doctor you're looking at has had. Now, don't live and die by these ratings. I've been in the situation where people have they come to me and they want you to pay them, and if you pay them, then they'll boost your rankings or they'll hide negative reviews and so on. So you got to be careful with that. I've also had people who have never been a patient of mine who have left fake reviews on my clinic previously in the past. So there's that kind of stuff that can happen as well. So just be aware that reviews can be manipulated, but you may get a general idea of what's going on there. Just don't live and die and make your ultimate decision based off of the reviews because they can very easily be manipulated, and they often are, especially in really competitive things like plastic surgery and so on. You'll have people that'll just create fake accounts to try and negative review bomb plastic surgeons and so on. It doesn't always happen in the type of fields that we're talking about, but it definitely exists out there, so be aware of that. The next thing that you can do is you can use doctor directories from holistic training centers. Okay, so what this means is that there are these additional training centers, and I'll give you a couple examples, like IFM, which stands for the Institute for Functional Medicine, Andrew Weil Center for Integrative Medicine, and also A4M. These are entities which will train doctors after residency, and what they usually do is if you go through all of their training programs and classes and so on, and you end up with some sort of certification to show that you've done that, they'll add you to their directory list. So if you are a patient and you search for these directories, you can actually look by state and say, is there anybody who has been certified in functional medicine near me? And you can look, within a 50-mile radius or something like that. So you can use these directories to try and find somebody that is near you. Again, it doesn't guarantee that this person is going to be great. I mean, there's lots of people who go through training who end up and they're not very good at the end of it, but it's still worth a try if you're having trouble finding anyone near you at all. So you can use these directories. And by the way, I will include links to these directories, the ones that I mentioned here. So IFM, the Integrative Medicine one, and the A4M one. So I'll leave those links below if you want to look at those directories down below. The next thing that you can do is you can ask for referrals in thyroid Facebook groups. Now, I am not a huge fan of Facebook groups, especially thyroid Facebook groups, because I think there's a lot of bad information that is spread throughout those. However, you might be able to find good information, especially in the case of getting referrals to other doctors. So if somebody who has seen a doctor locally or near you or anywhere near you, even within 50 miles or even 100 miles potentially, and they have said they've had a good experience and they know that this doctor is willing to prescribe natural desiccated thyroid or Armour thyroid or Tyrosine or whatever it is, there's a pretty good chance that they'll also be good for you. So you can use them for certain instances. I wouldn't get your thyroid advice from them necessarily, because I think that's where people fall into trouble. But getting referrals through doctors using these Facebook groups can potentially be beneficial. And there are some places that have these lists. My experience with these lists is that they're not very well updated. Doctors are always changing and coming in and out and moving and so on. So they're not always kept up because there's very little incentive to do so. But if you can find somebody, it is worth it, right? It's just another potential avenue that you can use to try and find a doctor that is good near you. The next thing that you can do, and this is a really good one as well, is you can contact advanced laboratory testing centers and ask for a list of doctors that order their list order these tests by state. And so there are a number of these labs which are different from, let's say, Quest and LabCorp in that they're ordering more advanced testing. Now, some of these tests are dubious in terms of the results that they give you. That's not really the important point. I'm not talking about that right now. But most doctors who focus on integrative medicine and functional medicine and who are more likely to help thyroid patients, they tend to order from these lab tests, okay? So I'm not talking about the tests specifically, or I'm not endorsing those tests, and I'm not saying they're accurate or anything like that. But I am saying that this is one way that you can reverse engineer what type of doctor you should be seeing. So I'll give you a list of several here, and I'll include links to these below as well. And most of these places, if you were to call them up and ask which doctors order from them, they'd probably give you a list as well. So we have Dutch testing, which is a hormone testing. It's a urine type of test, and it's a 4-point urine test that you can use to order various types of hormone levels inside of your urine, and I think they have a list of several doctors that use this type and order this type of test. You have Genova, which does a lot of stool testing. You have Great Plains Laboratory, which does organic acid testing. We have ZRT Laboratories, which does salivary cortisol testing, and also Cyrex Laboratories, which does a lot of food testing and things like that. So I'll include links to those below, and you can look around and you can see if they have a list of recommended doctors in your area. It doesn't guarantee that these doctors will be able to treat your thyroid, but it puts you on the right path, and it helps you to look in the right place. And there's a very high chance if somebody's looking at food sensitivities or testing salivary cortisol or ordering a 4-point urine test of various hormones like estrogen and progesterone, there's a good chance that these doctors also have at least some knowledge, and probably more knowledge about alternative thyroid treatments compared to family practice doctors and endocrinologists and so on. The next thing that I would do, and this is kind of a no-brainer, would be to look for doctors that write blog posts, host podcasts, or have been invited onto podcasts, or who have done something like an interview, or create their own YouTube videos. Now, this is kind of tricky because by the time somebody is like really well known, they usually have so many patients knocking at their door that they're not accepting anybody. So if you want to find somebody who's kind of just getting started in their early infancy, who doesn't have a lot of exposure, and that can kind of make them more difficult to find. But if you find them early on, you're much more likely to get in. I remember when I started doing all this stuff, it didn't take more than, like, let's say 6 months or so in order to fill up my practice when I first started doing this sort of stuff. So, and I'm not seeing patients now, but that's how quickly it can go. So if you can find somebody in the very beginning, you're much more likely to be able to get in and get help using that strategy. The next thing is I would recommend that you look for doctors that specialize in anti-aging medicine, bioidentical hormone therapy, integrative medicine, functional medicine, or personalized medicine. So look for any doctor which, when they lay down their shingle, they have these buzzwords anywhere on as a form of advertisement, either on their clinic website or maybe when you call in, they say something about this. Just look for people who specialize in these areas because these are doctors that are much more likely to be able to help you. And so that's what I'd recommend in terms of the holistic type of doctors that you'd want to see. And these are separate from those that include things like endocrinologists and family practice doctors and so on. These are doctors which specialize in a completely separate part of medicine. And then lastly, if possible, you can get referrals from local health coaches or chiropractors. So if you're already seeing a health coach to help you with food sensitivities or going gluten-free or eating keto or something like that, there's a good chance that this health coach probably has seen other patients and they have a network and maybe they know a handful of doctors which they trust and would allow them to treat themselves, and you can get referrals from them. Same thing goes with chiropractors. So some chiropractors have certain types of doctors that they're willing to refer to because they know that they'll handle their patients who have hormone imbalances or thyroid problems or estrogen problems, etc. So you can talk to a chiropractor if you're already seeing one to see if they have referrals. I don't know that I recommend going to a health coach or going to a chiropractor for the sole purpose of trying to get a referral, but it doesn't hurt to reach out and ask because they might have something, or it might be a source of referrals that you may not have thought about. So here, I don't know how many that was, 8 or 9 of these tips, but this is what I would do if I was starting over and I needed to get help. And if this ever happens to me where I need to have my thyroid managed or something like that, this is exactly what I will do. So start with these tips, and if you need to, I will leave the links to the references that I mentioned inside of this video below in the description, so check those out as well. And if you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information all designed to help thyroid patients like you feel better, so make sure you check those out. And otherwise, that's all I have for you guys, so I will see you in the next one.